Welcome back to Talk 1260 KTRC, the Humanity Behind the Vanity. It's Dr. Daniel Ronel here with my wife Betsy.
I'm still
who's dying
around.
to tell us about something.
Well, I have to tell you about the volunteer opportunities for Espanola Animal Shelter.
Okay.
This Sunday, November 14th, from noon to 5 at the PetSmart in Santa Fe on Zaffarano, we are having 30 animals, and we need to get them home. And we need to have people help us set up, break down, and handling these sweet little animals. And children are welcome to attend with an adult for volunteers as well as patrons.
She's reading this off of her cell phone.
And also Black Friday. This is the best. I love this. Okay. November 26th, Sunday through. Oh, here it is. Friday through November 26th through that Sunday, the 28th, at the shelter in Espanola. This is very true. Black animals. Black animals are often. This is the most important. Sorry, Daniel. Okay. Black animals are often the last to be adopted, which is very true, people. You know how many black animals I have? Because I personally am drawn to them. Maybe it's because subconsciously I know the white and the pretty ones are always going to go. To me, the black are exotic, beautiful. Remember last show I said always bet on black? That's my motto. Okay. So, you know, black animals, they're extraordinary and they're so I just love them. I prefer dark animals to light ones. Anyway, we need to get all of those adopted dogs and cats. We need people to walk the dogs before the adoption event happens. We need people to write messages on each of the special pets. All of that. You can look on our website, evalleyshelter.org. We also have on November 26th, here's something cool, the Han Ross Gallery on Canyon Road is featuring new works by 6 artists, and all of them will benefit the Espanola Valley Humane Society.
Good. They're great. I love that gallery.
Yeah, and the exhibit is called Art for Animals. So these are artists who usually probably Joel Nakamura is going to be featured. And a bunch of, and Elizabeth Hahn herself, and it's just cool. It's cool. All right, please go, people. There's too many dogs out there. Please chop your dogs, you know what's off, and spay your female dogs and cats. We don't need any more animals running around this town or this state, for goodness sakes.
Yes.
You're not hurting the animal by doing that. You're hurting them by breeding them.
Right.
All right. Go on with what you think is important.
Hang on, I got two. I have an announcement too.
What?
The makers of Artifil, Suniva, just came out with a promotion for my practice until December 7th. Until December 7th.
This is because Daniel's a major seller of this stuff because everybody loves it.
You can buy Artifil for 30% off.
Well,
between now and December 7th. You have to call in. You don't have to get injected by then. You just got to purchase it.
Just buy it and it'll be on reserve.
The makers are making it available for me at a lower rate, so I can pass on that lower rate. So it's about 30% off, which is
that
huge
the equivalent?
savings.
Because a lot of people are like, oh, okay, I can't afford Artifil because it's too expensive. But I'll take the lesser expensive versions of things. Is this now equivalent?
Almost equivalent to Radius.
Listen, it's like saying I can't afford a Gucci shoe. I'll take, you know, a Steve Madden shoe instead, but now the Gucci is like 20 bucks more than Steve Madden. You are, no offense to Steve Madden, makes good stuff, but you are much better off getting a Gucci for a few bucks more than the Steve Madden.
Right over my head. But
yeah,
anyway,
sorry.
So call the office to find out about it.
The point is you're getting high-level luxury good here for a medium price level.
Yes, no, it's a great price. Okay.
Yeah, come on in. All right.
So a couple weeks ago,
and also he's going to be featured in Women's Wear Daily, for those of you who know what that is. It's the fashion trade magazine, but very fashionable people always read it. I don't know if we even have it here in Santa Fe.
It's at Chrysalis. I've seen it there.
Chrysalis, oh well, the Chrysalis has a subscription because Rick knows what he's doing. Anyway, but you can look online. He's major featured, major quoted throughout this awesome article. And he's in there with Cheryl Astin and other bigwigs that have set the tone for plastic surgery. Anyway, this is the big time, baby.
Okay.
Okay, go with what you really want to say.
This is interesting. I went to a conference recently in Miami on fat transfer to the breast, and we have talked about this before.
I've even asked you about it.
Yeah, I've been against it because the data up till now had said it's probably not such a good idea, mainly because of the risk of anomalies on mammography. And so that people who got fat transferred to the breast may have these little lumps that mammographers would think, oh, that's a cancer. Not true. Not true. data really now, the most recent data, is showing that the changes in a fat transferred breast are less than the changes in a breast that has undergone a breast reduction. And people get millions of people get breast reductions.
Not augmentation,
right,
reduction.
Millions of people get breast reductions all the time.
Right.
And mammographers know how to deal with it. And
right.
so they don't bat an eye about dealing with somebody who had a breast reduction. And so fat transfer is even less of a problem than that. So that's the first thing that I wasn't sure about. Now that has been laid to rest. The second thing is, how long does it last? I have always thought that fat transfer does not last very long. And in certain cases, that's true. But there is a relatively new technique that we talked about in Miami that's championed by Dr. Khoury, K-H-O-U-R-I.
Oh, even I've heard of him. Okay.
Roger Khoury. He's got 5-year results. 5-year results with a stable breast that hasn't changed in 5 years. And that is fantastic. So what you have is you can augment the breast about 1 cup size. There are no incisions. You get liposuction at the same time.
Wow!
Because the fat is removed from
right.
your own body.
Right.
So it's not for big
2
augmentation.
for 1, ladies.
Right. It's not for
That's
big
right.
augmentation. It's not inexpensive because you have to also pay for the liposuction.
Right.
Those are all the advantages. And it obviously feels natural and it looks fantastic. The disadvantages are, for breast augmentation, you have to wear a suction cup on the breast for at least a week. It's like 10 days. And these things look like basketballs. They're enormous.
Oh my God.
What you have to do is expand the space in the breast in order to accept the fat into it. And
normally you'd put in what are those sizers? What are those called?
That's for breast reconstruction.
Right, I'm just saying, for breast reconstruction, what do you put in?
A tissue expander.
Tissue expander, right.
This is a tissue expander, but an external tissue expander.
So there's
you
no
wear
surgery.
these enormous suction cups, and you got to wear them for about 6 to 7 hours a day, maybe 8 hours a day. So for a working woman, she'd have to do it at night and sleep with it, which is logistically demanding.
Yeah,
so if you're interested in this, come in and we'll tell you all about it. There's a huge support network.
Interesting.
From the company that sells this stuff, because they realize it's not easy to do. But really, the advantages are
wait, I have one question.
just terrific.
What if you get fat? I mean, we all get fat
It will
up and
increase.
down.
No, your breast will increase
what happens if
and
you get
decrease.
Thin?
Same thing. They'll increase and decrease with you, but it will be proportional. It will be proportional. So anyway, that's a great question. You know, we'll see. We'll see
what about,
you
like, sometimes, no, I'm not convinced. I personally like my big boobs, and they're fake, and I don't care. I love
right, it's
them.
not for people who want a big change.
Right. But here's an example. Like, sometimes you have women who have smaller breasts that have ptosis, sagging, and they don't want to really go up. They just want a fuller breast. So
it works for that.
Right. So sometimes you just put in a tiny implant right above.
Right.
Would this
in
be a
this
good
case, you
candidate?
actually put the fat in the inferior hemisphere of the breast.
The lower.
Yeah, which is interesting.
So, but someone like that who just wants a minor change would be a perfect
an
candidate.
excellent candidate.
Anyway, he doesn't know that he's going to really do it. He's not sure.
I'm sort of gauging the interest.
Right,
here.
but if you're interested, let him know.
Give me a call and let's talk about it, because I'll start doing it. Thanks very much for listening. We've got to wrap things up.
November volunteer
Talk
opportunities.
1260 KTRC, the Humanity Behind the Vanity.
Espanola Valley Humane. Go get them.
Bye.